Dr. Saketkoo, take it away.
Hello, thank you. It's really wonderful to be here. We're so grateful and wow, so many people showing up. And that's just proof that we are, when we need to, we stand together and we're here to support each other and uplift each other. And my name is Lesley Saketkoo. I'm a rheumatologist with a special interest in cardiopulmonary diseases related to autoimmunity, and that includes myositis. I'm here with my co-chair, vice chair, of which Julie Peck is also another one, Dr. Pedro Machado. And so, Pedro, I yield to you.
Thank you, Lesley. And it is a huge pleasure to be here today. And I will start by introducing MIHRA. So MIHRA is a charitable non-profit research organization, and we try to bring together investigators from all disciplines, patient advocates, and partner organizations to support a vision. And that vision is to create a world where you can cure myositis together. We aim to achieve this by accelerating highly collaborative holistic research worldwide, and we serve as a platform where research organizations, patient advocacy groups, the pharmaceutical industry and regulatory agencies, they can converge to tackle complex challenges such as those that we've been witnessing in myositis, namely designing and implementing innovative clinical trials, strengthening professional education and training, building robust and sustainable research sites, and cultivating the next generation of myositis researchers and clinicians. Now, through these efforts, we are all working towards improving global care for individuals living with myositis diseases. We also offer some valuable online services, including a global directory of myositis specialty clinics. We also have an up-to-date listing of current myositis studies and clinical trials to help both patients and healthcare providers find relevant studies for their patients. And our goal is to invigorate professional education, enhance clinical trials, and fortify myositis research sites, all with the ultimate aim of advancing care and finding a cure for myositis. So next slide, please. There are approximately 7,000 rare diseases worldwide. In the United States, a disease is classified as rare if it affects fewer than 200,000 people, or about 1 in 1,650 individuals. Now, in the EU, a disease is considered rare if it affects fewer than 1 in 20,000 people. This means that in total, there are over 30 million people in the US living with a rare disease, and over 36 million people in the European Union that are affected by a rare disease. This is approximately 1 in 10 Americans that will develop a rare disease in their lifetime. So rare is really not so rare. And importantly, rare diseases contribute significantly to chronic illness, to disability, and to premature death. And they affect both children and adults. In addition to the physical impact of the disease itself, living with a rare disease can severely affect psychological and social well-being. Unfortunately, many patients with rare diseases are often marginalized. Early detection and awareness is critical in managing these conditions and preventing the long-term damage and disability. In this context, myositis is an umbrella term for several rare diseases that affect the muscles and can also impact other organs or systems, including the skin, the lungs, the heart, and the gastrointestinal tract. Next slide, please. So living with a rare disease can often make individuals feel alone, outnumbered, or even less deserving of attention and care. However, an inspiring and surprising fact is that rare disease research contributes significantly to the greater public good. Many discoveries in rare disease research have often led to major breakthroughs in understanding and treating more common diseases. Rare diseases often provide valuable models and patterns that help clinicians improve their approach to diagnosing, understanding, and treating common diseases. So rare is more than just a number. So when we look at the approximately 7,000 rare diseases together, we see that rare is in fact a superpower, a powerful force for innovation, discovery, and improving care for all of us. Now, in the field of myositis diseases, countless researchers are working tirelessly toward finding cures, improving treatments, and developing strategies that allow patients to live more comfortably and enjoy life. However, research in this area does face several key challenges. The low incidence and prevalence of the disease makes large-scale studies difficult. The identification, recruitment, and retention of subjects is often challenging as the patient population is small and often geographically dispersed. Disease progression can be slow, making it harder to assess over time. Phenotypic changes can be difficult to measure and to track. Sometimes there's limited natural history data to guide research. Standards of care keep evolving or are not even fully established. And endpoint design and validation for regulatory trials can present a challenge. There's also a relatively lack of viable therapeutic candidates. However, things have changed significantly, I think, over the last few years, and organizations like TMA have had an important impact in these changes. There's an increase in the number of potential therapeutic targets developed through basic and mechanistic studies. Preclinical discovery and development tools are becoming more sophisticated with advancements in both in vitro and animal models, high-throughput screening facilities, and more robust standardized operating procedures for therapy testing. I think diagnostic capacity is improving worldwide, aiding in better identification and stratification of patients. I think the infrastructure supporting proof of concept trials is also evolving. Genetic research is improving and uncovering disease-causing mutations in genetic rare disease, but also genetic modifiers that can be important in acquired diseases. So I think we are witnessing change and the emergence of new partnerships among advocacy groups, academics, corporations, governmental agencies, and patients are accelerating this progress. So, Lesley, maybe I'll hand it over to you now.
Hey, thank you. That was wonderful, Pedro Machado. So in rare diseases, we stand strong, and we have to stand strong, just like we're gathering here today. And we're really showing who we are, and we're here for each other. And courage is coming from Latin, courage in French. You know, it comes from the word heart, and it means big-heartedness. And we need this big-heartedness to face the challenges of living with a rare disease. And part of that is whether we're investigators or whether we're patients. In order to do a good job, we have to look after ourselves. We have to move our bodies for our health. We have to invest time to look after our nutrition and get good sleep and make good choices. Let's see. And connecting with, I see, I'm a little bit off here. So, and we need to remember also that we may have a disease, we may be an investigator, but we are people first before we are a health condition. And we ask that of each other and recognize that we are people first. too many things open on my side. And so in order to stay strong, connecting with others is crucial, like we're doing today. We're coming here together, we're standing with each other. But part of that is selecting those who bring us joy. That's part of self-care. Gaining disease knowledge. And it's very important that when we're gaining disease knowledge, we're doing that together as investigators, as patients, and sharing that knowledge. And if we are a patient, if we are an investigator or a clinician, understanding the strategies and skills related to self-advocacy in and out of the treatment room, those are things that can bring us closer to health and bring us closer to each other. One of the things that I've found in my life is that the more that I participate, the more that I learn, the more that I'm engaged with others. And I begin to feel stronger because I'm supported by this wonderful network of colleagues, both investigators and patient colleagues. And I think, yes. So, and in terms of research, we shine our magic. We shine our magic through our hearts and relating to each other's hearts as human beings and bringing to this difficult situation ingenuity, creativity, listening spirit, so that we can problem solve together through this current of sensibility to each other and to the question at heart. And we learn together. And we are out there raising awareness about myositis and rare diseases in general. And this is our magic. And we share with each other 360 perspective of what it is to be working within a rare disease as an investigator and to be living with a rare disease as a human being. And it's only with these insights that we can help each other along. We don't know about natural history unless we truly know about natural history, unless we ask patients what from their lens, this blow-by-blow experience of what it is to live and live with the symptoms, how the symptoms evolved, to really understand the pace of the disease and the pace of the symptoms, and to really truly understand the burden, which also helps us to prioritize our research. And part of our magic is really remembering that the heart of everything that we do is not just brains, but it's brains about being bringing humanity to everything that we do, and not just saving the world, but saving our one-on-one relationships, and remembering that without everything else, if we don't stand together and we don't work hard to preserve our relationships, we lose our greatest asset. But we just will remember that we are all humans and we are all navigating through this life as human beings. And so we all come with our triggers and our misconceptions. And but we learn and we forgive each other, and we're always expressing gratitude to make it work. And when we step off and out of line, because we're humans, we are with gratitude, and we apologize and we move on. And very important in our worlds of nonprofit work and science is that we recognize that not everything is truly urgent. Some things are urgent, yes, but not even those very urgent things in the scope of what we do, like getting a grant in on time. It's not the end of the world. And knowing those things that are of lesser urgency, so we can invite collegial compassion and compassion for ourselves, because that's the essence of being able to continue this work. And the other thing that we do and need to continue to do as terms of rare disease magic is to work to preserve our best resources. And what is that? First of all, that's patient time, and that's patient life years waiting for a cure. And that means avoiding delays in research through developing pathways that avoid delays and use funds efficiently, and do not keep patients hoping to get into a clinical trial in limbo while they're waiting to enter a rare disease trial. So that means expediting institutional delays and having a special fast track for initiation of rare disease research. And as patients and actually as investigators, we're sending out lots of qualitative surveys and expert perspective surveys. So the more that both of us, patients and investigators, can participate in all types of research, the further along we are going to get. And then ensuring that the community voice is driving the research, that the patient priorities are driving the research that's selected as priorities, and also that we as a community are guiding research as opposed to, well, dare I say it, the almighty dollar. Okay. So two quick examples that I'd like to share with you. And I'm just going to send out a couple of PDFs now and also a link to our patient contact registry. Hopefully everybody will get those now. But one of our posters that we were going to present at the NIH FDA Rare Disease Conference was our work with the carbon hand study. And what was marvelous about this study is that it took a year from design to implementation to analysis in this rare disease. And we were able to have sufficient recruitment for very good power. The carbon hand is a glove that is worn on the hand in people with neurologic deficits of hand function. And this is very important consideration in people with myositis, but especially in IBM, where it is a hallmark of the disease that hand impairment is progressive. And what this glove does is it senses the through the neurologic tone what the wearer would like to do. And what it does is it provides supportive force so that that task could be completed, whether it's grabbing or pincing. So what we did is we joined forces. This is how we got this study that would have probably taken 5 years to do in 1 year. Joined forces, we convened an investigator global team of physical therapists, occupational therapists, patients, of course, MDs. We designed the program. We circumvented institutional delays. And how did we do that? Well, we used a single site IRB as the NIH supports. And within 2 weeks, rather than the customary 8 months, we were ready to go in terms of all of our approvals, ethical approvals. We worked with industry, and industry was on board supporting us with training and providing us devices. And we then collaborated with our gorgeous patient organizations. So with the help of the TMA, Rachel Bromley, Linda Colbert, we were able to get this trial fully recruited over the weekend of the TMA conference. And this was a positive trial that demonstrated a clear benefit for patients with IBM in feasibility and usability. The other study that demonstrates that we were going to share at the conference that demonstrates the community voice coming together and rare disease magic was the CAR T studies. And everybody has heard about CAR T studies by now, I'm sure. It's very exciting. It's a very aggressive form of treatment, but it's very important resort. We were finding that as a patient community, as an investigator community, that we were feeling a little bit inundated by the number of these types of trials. They were outnumbering our other types of myositis trials. Patients were feeling a bit pressured with ads and not feeling they were getting enough information, and the same with the investigators, not sure what we're getting into. So under qualitative research expertise, we decided to go to the community, ask the community, get guidance from the community, find out what's going on. We did so through eliciting open narrative on surveys, analyzing this data, holding a live forum, presenting what we learned, drilling deeper into these potential issues. And what we found was patients and investigators shared many of the same concerns. Like I mentioned, too fast, many patients being recruited at once without really understanding the safety implications, need better information, materials. That was very clear. And we were also concerned that patients that might be enrolled may have actually benefited from trying safer, effective options. And how do we control for that? And also, ultimately, there was no agreed upon treatment algorithm to define what exactly treatment failure was, which actually will impact patients from getting the appropriate care and this being used as a last resort, but also impacts the data coming in, that we're really defining, having well-defined inclusion criteria. So again, the end of this provided several deliverables that we are working on currently, which includes patient-centered, patient-driven communication protocols and educational materials, developing treatment algorithms to define what is truly treatment failure, engaging in dialogues between regulatory agencies and industry, patient, investigator communities, and also supporting our investigators so their time is not wrapped up in the logistics of setting these complex trials up, but rather caring for our patients.
Thank you, Lesley, so much.
Yes.
This is Paula, TMA's executive director, and that was a terrific overview. And I think you and Dr. Machado shared so much about what we can take pride in for rare disease. And I think it's not widely known that many of the advancements that have benefited all of human health have originated in rare disease. So this was really fascinating. I would like to invite Dr. Goyal to briefly react and to reflect on the question we've received about how the NIH sort of pauses and disruptions may impact myositis research now and going forward. So let's pass the mic to Dr. Goyal and then back to you, Lesley.
Well, thank you, Dr. Machado and Dr. Saketkoo. I couldn't agree with you more about your comments and your thoughts. For those of you who don't know me, my name's Namita Goyal. I'm a neurologist, I'm a myositis specialist, and I've had the amazing honor of being chair of the Medical Advisory Board at TMA. I've actually been a part of the TMA community for the past 10 years. And I'm so grateful to be here today. I'm a physician scientist and I work daily to try to improve the lives of patients with myositis. It's really because of this increased awareness that's really led to a surge in research and therapeutic development. And this has happened, like Dr. Machado and Dr. Saketkoo has said, because of efforts of collaboration from a network of clinicians, scientists, pharmaceutical companies, the NIH, but most importantly, from all of you, the patient community. I'm really honored to be a part of this community that works so tirelessly and fiercely to improve the lives of patients and with myositis. So to answer Paula's question, I look at this NIH interruption as a pause, but I have seen from even just this program today that it is not stopping any of us on the myositis side. The researchers, the scientists, the clinicians, we are still continuing our work. We don't anticipate stopping any of our work. Our passion remains, and irrespective of what the NIH is planning on doing, which none of us know, we are continuing our work. And thus far, the message has been to continue our work. And so I don't really foresee it being a major hurdle or barrier for our care in myositis. And I think this program really attests to the devotion and commitment that us myositis experts, community all have. I think this meeting is going to be a wonderful testament to the commitment that we all have in myositis research.
Thank you so much, Namita. Dr. Machado, would you like to make any additional comments or reactions?
Well, being a person living in the UK, you know, I see the news in the US with great concern, let's say, but I also have a lot of confidence, trust in my colleagues in the US and various organizations that I'll know will be able to overcome the difficulties, and they will be resilient, and the rare disease research will win. And we, on the other side of the pond, we're supporting you all, and we can count on us, you know, to partner with you in the even if the times to come might be difficult.
Thank you so much, Pedro. That's so well said, especially the part, if you don't mind that I repeat you, where you said rare disease research will win. I feel that very deeply, and I know all of you do too, and I really feel the support as well. And thank you so much on behalf of our community. While we would have very much enjoyed the privilege of interacting with our medical advisors and these esteemed scientists at their posters at the Rare Disease Day program at NIH and FDA that was postponed, this is truly the next best thing.